So, the founder of Whole Foods, John Mackey, is apparently starting a healthcare company. I think this is probably an extension of his vision from introducing Whole Foods and applying it through lifestyle interventions to treat health and kind of getting to the root of health or health issues, chronic conditions. So, I kind of want to talk about this and some of the good and the bad. I've actually been hearing about this from colleagues who are actually in his inside circle, and it's been talked for some time now. And there's a few players in the private healthcare industry now, like Amazon's trying to get into healthcare, CVS, so many other people. But I feel like this is going to have a little bit more lifestyle, evidence based, and positive impact, to be honest. A statistic that's highlighted here is that about 80% of healthcare spending is spent on 20% of the population. And in his own company, Whole Foods, he says he sees that it's about 10% of the employees where 90% of the spending goes there. I guess it's a little bit more appropriate with the Whole Foods that you'd think that people who work and align themselves with foods would probably live healthier lifestyle, and it actually does play out. So I guess like many visionaries and people who want to solve problems, he kind of wants to do something about it. So he's launching a direct cash pay system outside the insurance model. Now these are kind of pricey. It's about $350 for a 60-minute visit, and for each visit, it's going to be $350. $175 to get labs, and about $500 to the longevity plan if you have chronic health disease. Those are pretty high price tags compared to most stuff out there. Most DPC docs charge anywhere from like $50 to $100 per month. And where like they get this model is from direct primary care models. Direct primary care has been something that primary care docs have been launching recently meaning over the last 2 decades, kind of, that patients can, instead of going through insurance, can, work directly with the doctor and do a membership fee. And this article says about $100 a month, but you can sometimes get it cheaper for like 50 to 75. And like, this is not the only company who's trying to almost take a piece of pie from this model. This is what Amazon's doing, CVS, Forward, I think One Medical. They're all getting a piece of this cash pie. Are these corporations practicing medicine a good thing? I think there's always a silver lining to it. I think there's a lot of pushback in the medical community, especially from medical doctors who feel that only those who go to medical school should be practicing medicine independently like this and dictating how medicine is practiced. Love.life and John Mackey did not go to medical school. Neither did Amazon or CVS or all these companies. And they hire medical doctors sometimes to serve in a position and then allow, medicine to be practiced through them under the corporation's terms. We've been seeing a lot more of this over the last 2-3 decades, and most medical doctors would argue that it hasn't been good for medicine. Currently, there's conversations happening about banning the corporate practice of medicine. It'll be interesting to see how this turns out. I have colleagues who are very invested in this conversation and to see where this goes. And I'm somewhat rooting for them because I believe care should be physician-led and medical doctors should be making most decisions about how medical treatment should go. But I also believe there's room at the table for input because we all need to grow, and I think there's a lot of perspectives that should be heard and will benefit the conversation. Let me know what you think in the comments. Appreciate your opinion.